In rural Nigeria, traveling long distances to access quality health care not only worsens the people's health conditions, it also pushes them further down the poverty line.
Formerly, I'm a driver, 2 buses, Nissan and Hiace, where I have that time. I live comfortable to my wife. My wife gets 7 children. My daughter get this type of sickness, TB. I carry her to Abakaliki, go stay 2 months there before she's all right. My mom begins to sell all these motors in order to get money to carry and go to hospital. My work just closed. I know they fit driving again. If not be my wife, even feeding me, both their children, paying for school fees, buying book. I started to cough 1 month before I go test for Enugu. They said not TB. They started giving me a drug. Why they go hospital last time is 8,000. Before I notice and come back for this TB section here. The treatment while I'm receiving here is very, very good for my body. I'm getting myself gradually, till now.
The Global Fund Round 8 against AIDS, tuberculosis and malaria is aimed at strengthening the health systems. The CSS is one of the components of the health system strengthening, started in 2010 till date, a span of 2 years. The exact mission of the CSS is to mobilize the community members, because we realize that over time, some facilities might be available at the primary healthcare centers, but community members do not access them.
This health center is covering 6 villages. The total population of the world is about 10,000. The patronage of patients to the health center was not impressive, as, let's say, about 60 per month. Sometimes it will be 50. The issue is how to get to the community to mobilize them on the importance of how to use their own health facility.
CSS came into our rescue. I will have to say they came into our rescue. There are some places that they don't even go to the hospitals. I'm telling you, I'm not joking and I'm not bluffing. You got some communities, you got some villages. There are people that don't believe in Western medicine.
The husbands don't normally allow their wives to come to the hospitals.
In fact, we are in a little bit kind of in the dark horse situation before the intervention of the CSS actually.
To implement the CSS project, a coalition of civil society organizations known as the ATM Network receives technical and institutional support from ActionAid Nigeria. The AIDS, Tuberculosis, Malaria Network, ATM, comprises the Association of Civil Society in Malaria Control, Immunization and Nutrition, ACOMIN, the Civil Society for the Eradication of Tuberculosis in Nigeria, TB Network, and the Civil Society for HIV/AIDS in Nigeria, CSHSS. These organizations work to deliver on the CSS objectives at the grassroots through the ward development committees in the target communities.
Through CSS, we're able to understand community ownership. Having known that this is our own clinic, we're able to mobilize our people to know about HIV/AIDS, tuberculosis, and malaria.
We're able to give them a clear outline of the composition and roles and responsibilities of a ward development committee.
They are chosen by the community, and the community people have good rapport with them.
We meet monthly to discuss problems affecting the people of the world, particularly in accessing the primary health care built for the world.
They take our own message to the community. I, as an individual, cannot go to the nomadic area in the community and tell them that there is net, there is ATM on ground. They live in the bush. I inform the World Development Committee, then they go into the various community and pass the message across to them.
We carry three persons each, go to another autonomous community, create awareness there, tell them to come to the health center.
A tún máa ń jáde lọ bá àwọn ènìyàn nípa àrùn HIV, malaria àti TB.
At times we carry even the test tubes, go to that place and test them.
Àgbà ní ká máa lo condom, wọ́n dẹ̀ máa ṣe test. Wọ́n tó bá ti ní pa àwọn ni wọ́n fi rí pé wọ́n jẹ́ kókó bá àwọn ẹlòmíì.
HIV and AIDS. This is one particular issue that we have. Some people here in our localities don't believe the existence of HIV and AIDS.
We have made them to know that it's like other diseases. Because of that, they voluntarily came for that test.
I don't do it. Even last month, I went to do test, HIV test for inside Nasarawa State, inside town.
HIV test,
Sometimes we even have about 400 when we go on massive mobilization and sensitization.
By the time we have any positive case, we sit them down, we educate them fully. So, and we allay their fear that this time around is not a death certificate.
If you say I get HIV, I will collect medicine, make I take now. Abi, you said the medicine day, Abi.
We have HIV drugs for pregnant women alone. Any other person that have HIV, we will refer the person.
Across Nigeria, 550 ward development committees have been reactivated, and each receives a monthly stipend of 10,000 naira.
Which is meant to help them for proper documentation, such as typing, photocopies. It's also meant to help them get some little refreshments during their meetings so that they would not have to complain they are hungry, they are tired and all that, and shorten their meetings.
We don't only use that money for entertainment. There are some beds, dilapidated beds in the hospital. We call them a welder and mended the beds.
Ibi tí àwọn olóyún àti àwọn tó ń gba abẹ́rẹ́ àjẹsára ti máa ń ṣe ìpàdé, òjò máa ń pa wọ́n, oòrùn máa ń pa wọ́n ńbẹ̀, ara pákó àti páànù àfi ṣe ibẹ̀ yẹn.
Ara pọ́ǹpù tí wọ́n fi ń fín kó, ara oògùn la fi fín gbogbo ibẹ̀ yẹn tó jẹ́ kí ibẹ̀ yẹn mọ́.
The fund they are giving, the WDC now use it to build that women's center, and then they repaired our dispensary.
The borehole have got spoiled. After the renovation of the health facility, there was scrap of zinc. We have to arrive that the scrap need to be sold to buy a generator for water in the health facility. Even the community people themselves, they used to go and sleep in the street. Even their husbands used to complain that their wives are no longer sleeping at home, they are sleeping in the street.
Our wives now attend ANC. They come for routine immunization.
If you look or you go through our clinical record, you will see that the number of inpatients going for malaria treatment in our health facilities has reduced.
Our delivery, before we used to get 0 in a month, but now we can get about 6 women delivery in a month.
Tuberculosis, it used to kill many people.
It's a little bit history now in our community here.
You can't hear the thing while they talk at that time. But now, since I started to swallow the drug, as they give me good service.
Bí àwọn Global Fund tán ràn wá lọ́wọ́ tán bá tiẹ̀ lọ ní ìsìn ẹnu wa ti kò débi pé àwa náà mọ àwọn nǹkan tí a lè ṣe bóyá bí pẹ̀lú gọ́fúnà ni o tí yóò fi dàbí wípé nǹkan tán ń ṣe yìí á lè máa ṣe lọ tí ò ní sí ti pé bóyá àtúnṣe mọ́.